Earlier, the Ministry of Health revealed that the US government had approached Uganda over a proposal to have American citizens with Ebola treated in the country. A similar proposal was also presented to neighboring Kenya, which has not recorded any Ebola cases so far. The move sparked public protests in Kenya, with citizens opposing the plan. In an interview with NTV, the Permanent Secretary at the Ministry of Health, Dr. Atwine, said the US government initially shared the idea with Uganda. However, before Uganda could respond, the US opted for Kenya. From the developments so far, it appears the US government has opted to pursue the arrangement with Kenya rather than Uganda.
Because they have not come back to us. That was the beginning before they talked to the Kenyans. So when they told us that they are now going to work with Kenyans, then we stopped. We don't have any arrangement with them now. There's no arrangement with them on treating their people here.
However, the Ministry of Health says Uganda would have no objection to treating American Ebola patients should the US government revisit the proposal.
Americans, we work with them. They are our very strong partners. And if we have Ebola here and we are treating Ugandans and DRC, what is the problem with bringing an American and also is treated there? For us, we are we are not even Pan-African. We treat anyone who needs our care. That's why we are going to Congo to address that issue there. So if they have they have their people that are affected and they feel that we can treat them together with these other patients who we are treating.
Meanwhile, following the Ebola outbreak in the country, several countries including Canada, the Bahamas, India and the United States have issued travel advisories and restrictions. The US Embassy in Uganda suspended visa services on May 18th, just days after the outbreak was declared. The US State Department has since elevated its travel advisory for Uganda to level 4 and introduced restrictions for travelers arriving from Uganda and the Democratic Republic of Congo, among others. Uganda has so far recorded about 19 cumulative confirmed Ebola cases. Of these, 14 are imported cases, while 5 are Ugandan nationals. There are currently 13 patients admitted for treatment. 2 people have succumbed to the disease and 4 patients have been discharged.
The local transmission has been really very, very low. It is only those, the exposures, the health workers, the driver who carried the first case, whom I think we have even discharged, and also the taxi, the transporters. Actually now, the local transmission are the transporters of the sick from the border to Kampala, and the health workers. That is now the biggest bulk of the people we are looking at.
Although Uganda closed its border with the Democratic Republic of Congo, challenges remain, with people crossing through porous border points to seek medical treatment in Uganda.
There are some areas of the border that there's nothing there. I mean, one garden is here, the Congolese garden is there. There's nothing, there's no physical line. So, although we are strengthening surveillance around those porous borders, but you see, they are human beings. If people are really desperate to come in the country, you cannot, because some of them have been telling us they come in the night, in the middle of the night. This strategic decision we made to go the other side and treat them from there, that was the best.
Norbert Atkunda, NTV Weekend Edition.